My guest on the line is Dr. Kevin Bernstein, second-year resident at the Naval Hospital in Pensacola. Hey, you follow him on Twitter. He's Bernie MD 31. Lots of great information. We'll talk about social media later in our conversation. But now, we're going to be switching gears. We're going to talk about the meeting, and he's the resident chair of the meeting, meaning that he's the kind of the face of the meeting, kind of the guy that is going to be seeing a lot of speaking and at the podium and things, and the real leader out there, in addition to the team of residents that he is going to be working with during the meeting. But Kevin, just kind of starting out, so we're talking about national conference, and want to ask you, there's going to be a lot of, hopefully a lot of residents and students who'll be going to this meeting for the first time, maybe even stumbling onto this podcast before they go to the meeting. So for people who have never been to this meeting before, and you can slant it a little bit to residents as well, but describe a little bit the national conference of family medicine residents and medical students. What attracted you to it in the first place, and why the attendees, the people that are going to be going, are going to be really enjoying this meeting, Kevin?
So for the first question, what attracted me most to go to this conference, honestly, I went into it as far as just taking a step back. Most of our attendees that are students are first-time attendees, and a lot of them are fourth-year medical students looking for residencies. When I went into the conference, I was between my first and second year, so there weren't that many what we call underclassmen medical students going to the conference as opposed to the fourth years looking for the residency programs. So I had the unique opportunity in being able to kind of go there, not looking for my next job per se, but kind of getting a taste for the specialty and checking out, having more time for the workshops, as well as the congresses and checking out the student congress and parliamentary procedure and policy making. So that by going there between my first and second year, I had that opportunity where I wasn't going to just the residency fair and trying to figure out where I'm going to be going next year and interviewing. So that's kind of a little bit different. So if you are attending and you're not a fourth year, I would see this as an opportunity more to explore the specialty, to explore if you are on the fence about family medicine, what exactly family medicine is. Because when I went, I never really understood fully what family medicine was. I wasn't even going to go into family medicine in the first place. I was thinking orthopedics at that point. And I just went because I was on a 6 or 7 week primary care practicum in my first year, installing one of my mentors that came to be on that rotation. Which is also unique in having a first-year primary care rotation. Not many schools do that. And he told me about this conference, and I thought it was pretty intriguing as far as the scope, seeing kids to cradle to grave, and doing a variety of things, including procedures, seeing sports medicine, and with my interest in ortho, I really had an interest in sports medicine, being a team doctor, and then learning that I might not have to do a 5-6 year residency, possible transition year, and a lot of hours, a lot of time studying, for that extended period of time, versus doing 3 years and possibly a fellowship to go into sports medicine. So that was intriguing to me. So I just wanted to go to the conference, check it out, see what the family medicine had to offer. So that's exactly what I did. And you go there, and the environment and the passion that everyone that is involved with family medicine shows, and how friendly everybody is. And it was just definitely a life-changing experience, really, for me. And that this community, who I didn't even know, kind of opened their arms and they welcomed you in. And it was a kind of a sense of relief to see a community like that. So I definitely had a great time at that first conference. And like I said, I had the unique opportunity where I was able to check out the residency fair. Definitely overwhelming if you're there for the first time, especially if you don't have a plan of attack, as far as mapping out the different residencies, where they are, going there with a plan as far as what regions are you looking for. If you are sold on one region, do you want to just check out another one just to check it out, that type of thing, and having an itinerary of how you want to do it. And that's a big thing for the first time fourth year medical student attendees. You should definitely go in there with a plan of attack, for sure. And that's the biggest advice I can give for fourth years that have never been there before, looking for their residency and looking to meet with the different residency programs. The second, third year medical students, I would challenge them to go to the congresses, check out what we're doing for policy. If you've never been involved with parliamentary procedure, come out. You can write resolutions, you can create policy, you can change the direction of the academy on a variety of issues, and it's just really cool that you can go there, write something that you're passionate about, and eventually see it through as academy policy, where an organization that represents over 100,000 members will go out and advocate for something that you have a passion for. So that's really, really intriguing, especially for the second and third year medical students that may have never been to this conference before. As far as from the resident standpoint, a lot of the residents that go there are going with their residency programs, as far as helping with recruiting for the residency program. Not as many, the percentage of residents go there without their residency program just to attend the conference. Some have CME money, they go to the conference, they go to check it out, but a majority of the residents that go there are exhibiting with their residency program. So that kind of limits what the residents have as far as time to go out and check out the different workshops, the procedures, to check out the poster presentations, to go to the resident congress, to check out what we're doing as far as policy making and the issues that residents currently face. But again, for the residents that are involved with their residency programs, I would say if you have any free time, definitely go check out a workshop or two. Check out the Congress. If you have an idea that you're passionate about and it's not being currently addressed or not being addressed in a way that you want it to be by the Academy, go write a resolution and see if you can get it supported and passed through the Congress. That's the way we're able to change things and how we're able to get our ideas out there to the Academy and make sure that our voice is known.
Yeah, I mean, there's a great variety of workshops out there, kind of like hands-on type of things, and especially great for students, especially when they first go and get to do stuff. I remember some of my first conferences to go there and to just get hands-on things, clinical things, and to learn a little bit as well.